Hello and welcome. Thank you for joining us today to learn about the pathway to accountability, compassion, and transparency, or what we call the PACT Collaborative. I'm Melissa Parkerton. Oh, I am the director of PACT, and I am joined today by two of our founders and core faculty members, Dr. Evan Benjamin from Ariadne Labs, and Dr. Thomas Gallagher from the Collaborative for Accountability and Improvement at the University of Washington. Our other core faculty include Jeff Salvin-Harmon from the Institute for Healthcare Improvement and Lauga Sokol-Hessner, also from the Collaborative for Accountability and Improvement. In the next 20 minutes or so, we are going to do our best to tell you about what a communication and resolution program really is, why it's important, how some of the national trends are supporting this approach. And then we're going to give you an overview of the PACT Collaborative, tell you a little bit more about how it works, and spend just a few minutes on some of the details and next steps for getting started. So with that, I will turn it over to you, Tom.
Thanks so much, Melissa. And it's wonderful to have folks here today to listen and understand more about this really important work. I've been working in this area of how do we respond to harm in healthcare for over the last 2 decades. And I've come to learn not only is this an integral part of how we should respond and support patients when something has not gone well, how we should respond and support healthcare workers and organizations. This doesn't, despite our best intentions, come naturally to us. And so on the next slide, we just highlight what the central problem is here. We all want to deliver the highest quality care, but despite our best efforts, sometimes patients are harmed by the very care we hope will help them. Sometimes that harm is preventable. Sometimes that harm is not preventable. Our instincts and the historical approach to that harm has really been accurately described as deny and defend. And that approach of minimizing what we share with patients and families, focusing on really keeping what happened to ourselves, not providing any financial compensation unless the patient or family files a lawsuit. That traditional deny and defend approach has all sorts of downsides. It clearly makes things worse for patients and families. In our research with thousands of patients, we've heard time and time again, what went wrong in healthcare was bad enough, but the way that the healthcare providers and the organizations responded was like pouring salt in their wounds. It makes things much worse for clinicians when we don't have open, honest, supportive responses. The literature is clear now that an ineffective response makes litigation more likely, not less likely. And ultimately, we're really focused on the patient safety opportunity to make sure that when something does not go well, we're focused on learning both within and across the institution, strengthening institutional culture and climate, and improving public trust. So what is a communication and resolution program? Communication and resolution programs are principled, they're comprehensive, and they're systematic initiatives that respond to harm with compassion, transparency, and learning. And they have many different elements to them. You can see on the graphic, it starts at the top with early event reporting, continues with open, ongoing communication with patients and families, care and compassion for all, reconciliation, and learning and improvement. The communication and resolution program model is known by lots of different names. Candor, care, heart, heal are all examples of a communication and resolution program. And these have been around for probably a decade or more. But on the next slide, the field is really struggling with inconsistent implementation. Time and time again, we hear from healthcare organizations when they first get to know about the CRP work, oh, we already do that. But when they look a little bit more carefully, they realize that they're highly inconsistent in their implementation, where they use the CRP for some cases and not others, or use some but not all of the CRP elements for an individual case. And this inconsistent implementation is such a threat, in part because it fuels the concern of skeptics that communication and resolution programs are not about supporting patients and families, not about driving learning at all. They're actually a claims management strategy, which is not the approach we take at all. We see them as comprehensive programs focused on accountability, transparency, and compassion. And ultimately, this inconsistent implementation is such a problem because fewer patients, families, clinicians, and organizations benefit from the CRP process. Well, on the next slide, we'll talk just a little bit about all of the exciting developments that are happening nationally around increasing support from regulators and others for CRP. On the next slide, perhaps the most notable is the proposed CMS patient safety structural measure. Now, this is a draft measure currently under review, but it's made it through the first several rounds of review, and I'm hopeful we'll make it through and be approved, but we don't know that for sure. This is what's called an attestation measure, and it asks hospitals to affirmatively attest to all the statements within 5 domains to receive a point for that domain. And you can see those 5 domains. Communication and resolution programs cut across all of them, but were, for the purpose of the measure, put in domain 4, accountability and transparency, which is listed in detail on the next slide. And so you should think about, it's fine, thank you. You should think about, does our organization, could we currently answer yes to these statements? Our hospital has a defined, evidence-based communication and resolution program reliably implemented after harm events that contains the following elements: harm event identification, open ongoing communication, event investigation, care for the caregiver, financial and non-financial reconciliation, patient and family engagement. And importantly, statement 5, and remember, to get a point for this domain, you have to attest to both statements. Our hospital uses standard measures to track the performance of our communication resolution program and reports these measures to our governing board at least quarterly. So I'm very hopeful that the patient safety structural measure will be approved, and it represents really an important statement on CMS's part about the importance of the CRP work. There's other work happening nationally that's also very important. The President's Council of Advisors on Science and Technology from the White House issued a report on transforming patient safety. CRP was one of the few specific patient safety initiatives that was highlighted in that report, and it also plays a prominent role in the National Action Alliance to Advance Patient Safety. Well, the other thing to just note is that the organizations and lead faculty who run PACT really are the thought leaders nationally and are publishing in high impact journals important articles about communication and resolution program, including a recent article that my colleague, Dr. Alan Gachalia, and I had in the New England Journal on responding to medical errors, and 2 articles that Evan Benjamin and I had in BMJ Quality and Safety about disclosing medical errors and making communication and resolution programs mission critical. And we've collected a nice evidence compendium on communication and resolution programs that you can review at the link below. So with that, let me pass things over to Dr. Evan Benjamin to tell you more about the PACT Collaborative. Evan?
Thank you so much, Tom. It's a real pleasure to be here. And like Tom, I've been working on communication and resolution programs for the past 2 decades. Very proud to, along with Tom, to have co-founded this work and what we call the PACT Collaborative, the pathway to accountability, compassion, and transparency. Next slide. Our mission in PACT is to really inspire, but really guide healthcare organizations to help them implement highly reliable communication and resolution programs. What we have found through our research is that organizations are moving slowly to do this work, and yet they really need assistance in implementation. These are difficult processes to put in place. They're difficult conversations to have. And to really create a highly reliable soup to nuts program, having the right tools to assist implementation, we have found to be very helpful. Next slide. So what is the PACT Collaborative? It's really a learning community. It's the idea was we wanted to bring together leaders in patient safety throughout the United States who are interested in changing the way that they would respond to harm. We built the idea of a learning community and then created a collaborative structure. We borrowed this from the Institute for Healthcare Improvement, who then joined us as a partner in this work to create a year-long learning collaborative, which consists of learning sessions where we get together virtually over a day to talk about best practices, share tools, share measurements, and then have action periods where the participants are working in their own PDSA cycles to implement and apply what was learned in those learning periods. It takes 12 months. We have found that's a good time to really get things up and running off the ground or to solidify the reliability of existing programs. We use many tools and resources, which I'll share with you. Next slide. This is the overall structure of the Learning Collaborative. You can see it takes place over a year. Every 2 months, there's a learning session that you see there, the LS, in between these action periods. And it's in those learning sessions where we introduce the concepts, how to get leaders involved, what is high reliability for implementing communication and resolution programs, what are the tools, how to have these conversations with patients, how to do modern event review and tie that to the legal and claims aspect of your organization. And then organizations through those action periods are taking them back to their organization and coming back and sharing their progress and their challenges. Next slide. I mentioned 3 organizations. We're really proud. I've been at Ariadne Labs, which is the innovation center at Harvard University. My colleague, Tom Gallagher, at the Collaborative for Accountability and Improvement at the University of Washington. And we've had the Institute for Healthcare Improvement join us. Jeff Selman Harmon is their vice president for safety, who's also a core faculty member. And it's really these 3 organizations with really 3 different strengths to offer have come together to lead PACT. Next slide. What we've done is we've created a driver diagram. Like all good improvers, we said to do this well, what are the steps that are essential? Our Patient Family Advisory Council, when we talked about, we wanted to help others implement highly reliable communication and resolution programs. And we wanted to figure out, well, what actually is involved with that? They actually gave us these words. They told us, for a patient who's been harmed by healthcare, it means that someone's taking accountability for what happened, to say, hey, this happened on our watch, and we want to make it right. Patients said we also want to be treated with compassion. We want to be told what happened and now what's going to happen to us personally. And then finally, we want transparency. We want transparency to hear about what happened to us, but we also want the organization to be transparent among itself to help learn and to help prevent this from happening. So we took those words, accountability, compassion, and transparency, and we built a driver diagram of what are these steps. And this is really the core curriculum of the entire year program. I won't go through all of this, but it's been really successful to break it down into the elements and all the different components of what should happen in a highly reliable communication and reconciliation program. Next slide. We put together and we've been developing tools and resources. These are now 5 years in the making. We have a set of measurements to know if you're doing this well, what does it look like? How do you know that your communication and reconciliation program is working? We have put together a set of communication tools to really help guide conversation guides, to support patients and families in communicating, to support providers in learning how to be coached through those conversations, how to help get the patient narrative, how to help share the review findings, and then a number of different process tools that our participants have found to be very helpful in implementing their CRP program, and then tools specific for patients and families to really support them. All of this coming together to really support not only the patients, the families, the providers, but to create the learning that has to go on. Next slide. So, we've done 2 waves of this collaborative. We're now recruiting for the 3rd annual collaborative. We've had over 50 healthcare facilities from 28 different health systems join us throughout the United States. They have been incredibly successful developing their own communication and resolution programs, developing support programs that they had not had before, having new patient family advisory councils specifically to look at what happens when a patient is harmed, standardizing their work. So it's not just a single leader that wants this to happen. And we see that it's often inconsistent when that's the case, but to how to create standardized approach so that, every harm event that you define what harm is goes through a standard process, how that becomes part and parcel of everything from event reporting to capturing all the process measures. Next slide. So we've had so many folks go through this. This was just Larry Smith, who's the vice president at MedStar for corporate risk management. Larry was one of our early participants who says, many healthcare organizations believe the right way to bring healing and resolution to patients and families when an unexpected and unwelcomed outcome occurs is through honest, open, and ongoing communication. The PACT Collaborative can help any organization achieve success. Whether the organization is just beginning this important work or is well on its journey, the resources provided by the PACT Collaborative are invaluable now and will continue to be in the future. We thank Larry for those words, and yet we see it with the work of all of our participants who've been part of this. So we welcome you. Would love to have you join this movement to change the way healthcare responds to harm.
Great. So I'll just tell you a little bit about what it would look like to join. So our learning sessions for this next wave will begin in October of 2024, starting on October 16th with a learning session specifically for executive sponsors and team leaders. After that, all of the learning sessions are for full teams. Our learning sessions, each learning session is 8 hours virtually, presented over 2 4-hour days. People always want to know how much time will this take? And I don't want to suggest that it is easy or it doesn't take any time. It does. When it comes to our executive sponsors, we want them to come to that first 4-hour learning session specifically for leaders. They may choose to attend other learning sessions as well. And they might meet regularly with the collaborative team or join faculty consultation on occasion. We think it'll probably come out to about, maybe 1 to 2 hours per month for executive sponsors. For our team leaders, they're going to be putting in the most time. So we're looking at having them attend all of the learning sessions. They will be organizing and facilitating meetings with their collaborative team, consulting with their faculty coach. If they're collecting data, they're probably very involved in that, and they'll really be leading the implementation of new processes. So we think that comes to about 20 to 30 hours per action period. An action period is sort of that 6 to 8 week period of time between learning sessions. And then team members will vary a little bit. We think there will be a core team that is going to come to all of the learning sessions except for that first one for leaders. And they might participate in regular collaborative team meetings, and they may join faculty consultation and be involved in implementation of the different pieces. There may also be a broader consultation team that is brought in for specific elements. They might attend learning sessions that are specifically focused around their area of interest, or participate in implementation of just specific pieces of the program. Well, eventually, the time to implement your program may well come out of the time that we know you're already putting into responding to harm events. The truth is it does take time to establish new processes and put new strategies in place. So cost, we have worked hard to keep our costs as low as we can. We seek sponsors to help offset the costs paid by our participants. And the three organizations leading PACT are all nonprofits. We're really just trying to make sure we're covering the costs of providing the collaborative. So for this next round of PACT, the registration fee will be $29,000 per organization. And that will cover everything: access to tools, access to a password protected platform that we use, participation in all learning sessions, a designated faculty coach to support you during action periods. And then if you have additional teams that join, maybe you have multiple hospitals in your system that join, or maybe you have an inpatient team and an ambulatory team, an additional team would only be an additional $9,000 per team. And we're offering an early bird discount. So if you do submit an application before June 30th, you will have a registration fee of just $25,000 and $8,500 for each additional team. So next steps. First of all, we would be happy to talk further with anyone who has questions and wants to talk about what this might look like specifically for your organization. You can reach out to us at pact@ariadnelabs.org, and we'll get right back to you. You can also just complete an application, which can be found on our website, and submit that by June 30th for the early bird discount, or by September 20th just to participate, and then get ready to launch in October of 2024. And with that, we would love to answer any questions you might have. And I'll also go ahead and just put up our contact information, which you're welcome to copy down and reach